This was a trial that evaluated patients with radioactive iodine refractory differentiated thyroid cancer. And the trial was a randomized phase 2 trial that compared Cediranib, which is a vascular endothelial growth factor receptor-targeted tyrosine kinase inhibitor, either by itself versus with lenalidomide, which is an immunomodulatory agent, has activity in multiple myeloma as well as a number of other hematologic malignancies. And this is also a therapy that, at the time of this trial's design, also had some potential single-agent activity in thyroid cancer. The trial results demonstrated that Cediranib alone was quite active with an overall response rate or objective response rate of 44%, so on par with many of the other active VEGF or vascular endothelial growth factor pathway targeted therapies in thyroid cancer, and reinforce this as another potential option with activity in different radioactive iodine refractory differentiated thyroid cancer. However, lenalidomide, the immunomodulatory agent, did not seem to improve either response or progression-free survival as compared with Cediranib alone in differentiated thyroid cancer. And so this trial was stopped for futility at the planned futility analysis. I think the take-home of this trial is that, number one, it clearly reinforces the activity of VEGF, or vascular endothelial growth factor, targeted tyrosine kinase inhibitors in this disease as active. This remains our standard of care in frontline radioactive iodine refractory thyroid cancer, and furthermore demonstrated that at least lenalidomide as an immunomodulatory agent does not add anything and therefore shouldn't be combined with VEGF-targeted TKIs in this setting, and really highlights the need for improved frontline combinations with VEGF-targeted TKIs to improve response as well as progression-free survival in this difficult-to-treat patient population.